Good afternoon, Jen. Could you tell us how vulnerable exactly, or how much more vulnerable are senior citizens to this Delta variant according to the World Health Organization?
Yes, Charles, Dr. Beverly Ho of the Department of Health said that 60% of deaths due to COVID-19 are from senior citizens. And we know that the Delta variant is the most transmissible variant now. It is 60 to 70% more transmissible than the Alpha variant. Dr. Rabindra Abiyasinghe, WHO representative to the Philippines, said that 3/4 of our senior citizens are still unprotected of vaccines and with the Delta variant by maximizing our window period to vaccinate.
In order to vaccinate more seniors.
Yes, Charles. According to Dr. Abiyasinghe, because mobility is increasing, virus will continue to mutate, bringing more transmissible strain of virus. That's why the government must think of how we could appropriately and rationally use the vaccines because we have limited access to vaccines. He also said that it is incumbent for the local government units who are in charge of rolling out the vaccines to create a special provision so that our senior citizens would feel safe to accept the vaccines, and it would be easier for them to access the vaccines, according to Abiyasinghe. Charles.
Right, Jen, what did the WHO have to say about opening vaccinations to other priority groups, particularly A3 to A5, without having first vaccinated all of the seniors?
Well, Charles, Dr. Abiyasinghe recognizes that some vaccines have a short shelf life, and also because it is necessary to ensure that our economy stays functional, some LGUs have started prioritizing or inoculating other groups. But Abiyasinghe reminded the LGUs that since we have a limited supply of vaccines, we must have a clear focus on priority groups. He said economic groups are important, but the maximum impact will come from prioritizing the A2 and A3 groups. Charles?
Right, Jen, one last question before I let you go. I understand that the WHO is saying that our vaccination drive is on the right path. What was their basis for saying this?
Yes, Charles. The WHO recognizes the effort of our government in prioritizing vaccine rollout in areas with high transmission. Dr. Abiyasinghe even said that the Philippines, yes, it is. We are in the correct path in rolling out our vaccines. He also commends the Philippines, especially the DOH, for vaccinating more than 10 million people since March. 7.5 million have received their first dose. 2.5 million are fully vaccinated. 95.8% of our healthcare workers have received their first dose, while 70% are fully vaccinated. He said this is already an achievement despite supply challenges. But then again, Charles, he said now is the time to prioritize and protect our A2s or our senior citizens because they are more vulnerable to get severe infection and succumb to COVID-19. Charles?
Thanks for that, Jen. That was Jen Calimon reporting live from Malabon.